The most common question I'm asked across my social media is this: how can I get bigger? How can I increase length? Or how can I add more girth? Today, I'm going to answer those questions and walk you through the evidence that exists behind penile lengthening treatments. I'm Dr. Hannah Kim, a men's sexual health urologist and pelvic surgeon. A urologist is a physician who treats the genitourinary system both medically and surgically. If you find this information helpful, be sure to subscribe so you don't miss new videos released every Monday. So, did you know there was a large survey conducted on 50,000 heterosexual men asking about penile appearance? What researchers discovered was that 55% of men were dissatisfied with how their penis looked. However, when those same men's partners were asked, 85% of women reported being satisfied with their partner's genital appearance. At the end of the day, how you feel about your own body matters. But the issue becomes complicated because pornography has significantly distorted perceptions of what is truly normal. I previously made a video discussing average penile length, and when you review all available data, the average erect penile length is approximately 5.2 inches or 13.2 centimeters. It's considered normal for length to fall within 2.5 standard deviations above or below that average. What is classified as abnormally short is anything under 2.9 inches or 7.5 centimeters, a condition known as micropenis. Micropenis is extremely uncommon, occurring in only about 0.14% of the population. It can result from congenital conditions, hormonal abnormalities, prior surgeries, or cancer. Today, however, we're focusing on individuals who fall within the normal length range. While it's true that most men concerned about penis size are objectively within normal limits, the real issue lies in the emotional distress some men experience related to believing their penis is shorter than it should be. This distress falls under a form of body dysmorphic disorder with a specific name: small penis anxiety. This doesn't mean the man has a small penis. It means he experiences anxiety centered around the belief that his penis is inadequate in size. Small penis anxiety is defined by an intense preoccupation with penile size, often involving more than an hour per day spent thinking about it. In some cases, this distress becomes so severe that it interferes with daily functioning. There are even individuals who end up hospitalized due to overwhelming obsession, and in extreme situations, some experience suicidal thoughts. This is not something to dismiss lightly. It's serious, and it can have real dangerous consequences. That's why it's crucial to address this topic openly as part of men's health. Another major concern is what happens when someone searches online for ways to make their penis longer. They're immediately flooded with countless websites and claims, many of which are not credible. Some men travel abroad or seek out unlicensed providers who perform procedures that can lead to severe complications. Please don't do that. Instead, seek help from a reputable urologist or psychologist who is experienced in managing these concerns. I also want to preface the rest of this discussion by noting that the Sexual Medicine Society of North America states that penile lengthening and girth enhancement procedures are not recommended and are considered experimental, except in cases involving true micropenis. The information I'm about to share comes from urology literature and does have some supporting data. However, before considering any of these options, it's essential to establish care with a qualified urologist familiar with these treatments. As a disclaimer, I do not personally offer penile lengthening procedures in my practice. But because this topic is so important, I reviewed the research to present accurate information. Treatment options for individuals experiencing small penis anxiety or distress related to perceived size generally fall into two categories: non-surgical and surgical approaches. Starting with non-surgical treatments, psychological counseling is a key option. There are validated questionnaire assessments and tools that help men understand what normal penile size truly is while addressing anxiety surrounding body image. Interestingly, studies show that men who undergo psychological counseling alone often decide they no longer want any additional treatments, whether surgical or non-surgical, to alter penile length. This is significant. If you're struggling with anxiety related to size, I strongly encourage seeking professional psychological support. Beyond counseling, there are 3 additional non-surgical options discussed in the literature. These include penile extenders, vacuum devices. Erection devices are the second option, and the third involves penile injectable treatments. Among these 3, the only method that has any data suggesting a true increase in penile length is the use of penile extenders. These devices consist of a central opening where the penis is placed, 2 metal rods running along the sides, and a silicone ring at the end that secures the glands. The device works by gradually and mechanically applying traction to the penis over time, encouraging lengthening through sustained tension. This process requires many months of consistent use and a significant daily time commitment. When researchers reviewed the data, they found that men who used penile traction devices very consistently did experience some increase in length. Measurements were taken using both flaccid length and flaccid stretched length. In urology, flaccid stretched length is commonly used as a surrogate for erect length, as studies have shown the 2 measurements closely correlate. So, what was the final result after months of daily use? On average, the increase was about 2 centimeters. While there was measurable improvement, the gain was relatively small. Achieving this result requires strict compliance with several hours of use each day. There are also potential side effects, including numbness, bruising, or simply no noticeable benefit. Some men invest a great deal of time without seeing any meaningful change. That said, penile traction therapy is the only non-surgical option in the literature that shows consistent results with relatively low risk of serious side effects. In contrast, vacuum erection devices have not been shown to increase penile length at all. As for penile injections, multiple injectable substances have been attempted over the years, many of which have led to severe and lasting complications. For that reason, I do not recommend penile injections. In fact, next week I'll be discussing the history of penile injections, including which substances were used and the good and bad outcomes associated with them. At this time, the available data is not strong enough to support any form of penile injection, especially given that devastating complications have been reported even decades later. Please do not inject anything into your penis when it comes to surgical treatments. Numerous procedures have been described in the literature. One of the most commonly discussed is suspensory ligament release. The penis is anchored to the pubic bone by a ligament, and cutting this ligament can create the appearance of added length. However, this procedure carries significant risks and complications. Other surgical approaches include the use of tissue flaps, grafts, and even rib cartilage to increase penile length. Overall, these techniques have shown poor outcomes and low patient satisfaction. Additionally, the studies reporting on these surgical procedures have not been conducted or reported with sufficient rigor. At this time, there is no surgical option for penile lengthening that can be recommended without a substantial risk of complications. The only scenario in which penile lengthening surgery should be considered is within a clinical trial. A clinical trial is conducted at a medical institution under the oversight of an institutional review board, or IRB. The IRB ensures that studies are ethical and safe for human participants. It also requires ongoing data monitoring and formal reporting of adverse events. This process allows complications to be accurately documented and published so that physicians can evaluate outcomes objectively. That's how we determine whether a procedure is truly safe and effective, based on real numbers rather than anecdotal claims. The bottom line is this: there's very little that can be done to significantly change the length you were given. Penile traction therapy may offer a small increase, and this is supported in the literature. However, many other approaches remain experimental and are not recommended for routine care. First and foremost, addressing anxiety with the help of a psychologist is critical before pursuing any intervention that could be irreversible and leave you with a result that is disfiguring, non-functional, or worse than where you started. Thank you so much for watching. Be sure to join me next Monday when I'll be discussing penile injections in more detail, including the side effects and complications seen in patients who have injected or received injections of various substances. And always remember to take care of yourself because you're worth it.